Hey, it's Jessica DaMassa with WTF Health, and I am here at AHIP's Consumer Experience and Digital Health Forum. And joining me right now, I have JP Stephan. He is the Managing Director for Accenture Health and has just come out with a very interesting report about the Healthcare System Literacy Index. So tell me about the index. What was it, and what did you guys measure? Because some of these results, people, you're going to want to hear. I mean, they're not good.
Well, basically, Jessica, it was a survey that we issued, but it wasn't perception that we were asking of U.S. consumers. It was essentially a quiz or a test.
Okay.
So we try to understand the consumer's understanding around terms like coinsurance, premium, if they knew the difference between an in-network versus out-of-network doctor.
Okay.
So it was really a test.
Okay, so you tested how many people?
10,000 U.S. consumers.
Okay, and what did you find out about these 10,000 people? How did they do on the test?
Well, they didn't do too well. So 52% of them failed.
Okay,
So
so more than half.
More than half,
half
of
have no
Americans,
idea what
yeah,
those words
they
mean.
failed.
Okay.
They failed the test. Yeah.
And you were looking more than just like testing them on vocabulary, because like, I mean, basically like what this means is that people are having a hard time figuring out how to buy a health plan.
That's right, yes. And so the unique part of this is really taking a look at a consumer with an insurance product and if they could navigate the system.
Okay. So, and by navigate the system, you mean like figure out how to actually use their health plan.
Yes,
Okay, like
yes.
whether or not they needed a pre-auth, whether how much they were going to pay for something, and 52% were like, no.
They have no idea.
No.
Right.
No clue. Okay, and what about the other 48%? What did you find out about them?
Well, we saw that only 16% would really get an A in the test, right? So there's about 30 or so percent that are proficient, but they're far from being an expert in terms of using their insurance product.
All right, so I'm doing the math here, and we're like in the 80s, right? So like 84% here, 86% here. I have no idea how to really use the health system. Okay, so I understand too that you correlated this to like an admin expense, like how much these people are costing the system. So I want to come back to this point about like the fact that nobody has any idea how to use their health plan, but it actually equates an expense. And so tell me a little bit about what you find out there.
So what we did is we compared the low literacy consumers with the high literacy consumers, and we found that the low ones are calling customer service 7 times more than the high literacy consumers, 1 to 3 times a week. So these are frequent callers.
They're frequent callers. And like, this is like, I mean, I could see doing this myself, where it's just like somebody tells me something and I hang up the phone and I'm like, wait a minute, what?
Yeah.
So they're calling a lot.
Right.
And like, I mean, how much is that equating? What was the number? It was like $4.2 billion in admin expense?
Yeah, well, it's $4.8 billion. And so these low literacy consumers are really costing the system.
And there's a lot of them, because it's like the 52% we're talking here.
That's right, yeah.
Okay, so tell me, I guess, what does this mean? I mean, and not just for the health plan audience that's here at this AHIP conference, but also for like the broader like health tech community, the innovation community that's trying to fix something like this. I mean, can you solve healthcare complexity? How do you fix healthcare literacy?
Well, I think what these digital health companies are going to bring is a different way of doing business, right? They need to identify the problem, which problem are they going to solve around health literacy, and they'll use different methods to do that. And they'll be a lot more agile. Okay. I think a big reason why we're not solving that as part of industry is the organization's getting in the way. Okay. The organization can't get out of its own way to start solving some of these problems for the consumer.
I mean, can we speak to consumers in English? Like, do we have to use those words, like deductible, coinsurance? Do we have to use those words? Well, I mean, are we like mandated to do that?
Well, there is some regulation around it, but there are some startups out there that are completely eliminating the deductible. So they're saying, let's not even try to rename it. Let's just get rid of it. Now, there needs to be a business model around that, but they're experimenting.
Well, I mean, definitely, and as we're seeing more consumer tech companies come into this space and bringing their customer experience with them, whether it's an Amazon or an Apple or even like Uber and Lyft, who are already into healthcare, they're bringing that frictionless, like all I've got to do is look, point, tap, and there it is. I mean, so I guess after looking at this study, I mean, are you optimistic? I guess like by calling this out and painting a picture with some actual numbers about how bad it really is, are you optimistic that the establishment in the healthcare industry, so like the plans, the health plans, the payers, the hospital systems, the pharmacies, the things that people really have trouble with, are you optimistic that they're going to be able to turn this around and reduce the complexity and fix the system and simplify it?
Well, I think it's going to have to be a system-wide solution that includes digital health companies, payers, providers, even community organizations, communities like the YMCA. There are going to be a lot of organizations that are going to need to be at play here for this. And with the call center metrics that we used, we're just scratching the surface. Yeah. When you start to address medical costs, that could be 40 times the admin cost that we identified.
Oh my gosh. So one other question for you on that. I mean, so what's the burden on the consumer here? I mean, because they're not blameless in all of this, right? Like, so it's like, you know, you're getting your health insurance from either your employer or you're buying it yourself or whatever. It's like, is there some responsibility that they need to take for learning how to use it? I mean, like, where does that line blend? Like, how much of this is the consumer's problem and getting more educated, and how much of this is the health system's problem in getting more simple?
Well, I think it's joint accountability, but I do think that as an industry, we need to shift more on putting the burden on the system. Okay. When you think about consumerism, it's about helping consumers understand and navigate and empower them. You don't want to make it a terrible experience for the member. And we know right now we're giving them a bad experience. So I think the pendulum needs to still swing more on the system for reducing and simplifying this complexity.
Well, hopefully these numbers will be some fuel in someone's PowerPoint and a health plan for helping change this. JP, thanks so much for stopping by to talk to us. Where can people find this this study report if they want to download it?
It's on our website, and Harvard Business, Accenture.com. Right. And Harvard Business Review also published a piece on the research as well.
Right, very cool. JP, thanks so much. I'm Jessica DaMassa with WTF Health. Thanks for joining us.